Most of us have been in a life-threatening situation at some point, and luckily we made it through. These simple life hacks will make things easier that will save you when SHTF. Not all emergencies are created equally though, and it's important to know what to do when your life is on the line. Life is stressful and complicated and mostly always tough, but that doesn't mean you can't make things a little bit easier. A few tips and tricks here and there that will help make the road in front of you kind of smoother. If you're new to the channel, do subscribe and press the bell icon. In an emergency situation, the first thing that comes to our mind is the advice of our friends and family. Even the most useful recommendations and suggestions turn out to be harmful and wrong. Here are the most common myths about first aid and what you should do in emergency situations. Dealing with a foreign object in the eye. At first, if there's something that goes in your eyes, like a piece of glass or a strong material, don't do anything by yourself. Have someone's help to take you to hospital. If the object is just an eyelash, then blink your eyes to locate the eyelash. Wash your eye with a bowl filled with water, see it in the mirror, and use a clean wet cloth to remove the eyelash. Don't miss the next trick that will help you in every circumstance. Applying ointments to the wound. Ointments carry abnormal moisture, which is a great place for bacteria to regenerate as fast as they can. The best possible thing you can do is clean the wound in cold water with germ-free soap. And the next step is to put a dry bandage on it. It's guaranteed that the wound will heal quickly as soon as possible. If the wound is very severe, then you must go to the hospital, take help from the doctor, and have some medicines prescribed to him. Rubbing a person with a fever with alcohol or vinegar. It would be like magic if it worked, but it just doesn't. Simply rubbing alcohol on the skin to reduce a fever is not a great idea. While it's true that the alcohol can instantly cool the skin, it actually works too quickly. But alcohol rubbing may create intoxication, while vinegar may significantly raise acidity, which is dangerous to children. So don't listen to this type of advice. Rather, you do have some water and drink tea at a regular interval of time. You must ensure the area of the room cools to a temperature of 61 to 64 degrees Fahrenheit, or from 16 to 18 degrees Celsius. In maximum cases, the patient will get over the fever by themselves. If they don't though, they must go to the doctor and take medications. Lifting up an unconscious person. If you carefully lift the person to a standing position using your legs and not your back, lock the knees out, which will help keep the person upright as you maneuver to the front side. Put your back against the chest, start with the unconscious person on their back. Bend the legs and stand with your feet on the toes. Pull him up by the wrists to a standing position. As you put the person into a standing position, rotate so that the person's chest is against your back and the arms are over your shoulders. Maximum care must be taken to avoid worsening an unstable trauma. The head, neck, chest axis must be kept straight too to protect the spine. And you must keep the patient's body stable during the lift. Treating burns with butter or sour cream. Putting butter on a burn quite likely does more harm than good. The same can be said for applying almost any sour cream or lotion to a burn, except lotions with a significant amount of aloe vera in them. Butter does not have any of the properties needed to treat a minor burn. It's not a cleanser, it doesn't fight infection, nor does it provide pain relief. To effectively treat a minor burn, physicians recommend that you cool the burn by running it under cool water until the pain subsides or placing a cool cloth over the burn. Do not use ice, however. Next, clean the burn with soap and water, making sure you don't break any blisters. After it's clean, put a thin layer of ointment on it, such as petroleum or aloe vera. And lastly, cover it with a gauze bandage. If needed, take an over-the-counter pain reliever as well. Setting a bone on your own. Are you a professional trauma surgeon? Well, if you answered no, you should never set a dislocated joint on your own. It may result in additional injuries. The best way to get a bandage and go to the doctor as soon as possible. If you break a bone, it's imperative that you get it treated. Regardless of whether the fracture took place in the body, the stress of a broken bone can be quite substantial, which means that you have to act sooner rather than later. For the most part, bones are exceptionally good at healing. Unlike other parts of the body, when they're treated correctly, you can make a full recovery and have a bone that's as good as new. However, if left untreated, the problem can get worse and lead to complications and more pain and suffering. If a person with a fractured bone does not get treatment from a doctor, there's a chance that the bone will heal in an unusual position. There are several treatments for a broken bone, and the one a doctor recommends is based upon several factors. These include how severe the break is and where it is. Applying warmth to a sprain. Never use heat where swelling is involved, because the swelling is caused by bleeding in the tissue, and heat just draws more blood to the area. Ice packs are often used after injuries like ankle sprains have occurred. Applying an ice pack early and often for the first 48 hours will help minimize swelling, and decreasing swelling around an injury will help control the pain. You can make ice packs with ice cubes in a plastic bag or wet tea towel. A pack of frozen peas is also ideal and can go in and out of the freezer. Never place ice directly on the injury though. Keep the pack moving to avoid ice burns. Never treat with ice for more than 30 minutes and remove the pack immediately if the injury appears bright pink or red. Ice packs can help minimize swelling around the injury, reduce bleeding into the tissues, and reduce muscle spasms and pain. You must see this video till the end to find some more simple life hacks that will save you from danger. Make yourself vomit in case of poisoning. The standard recommendation for poisoning is to make yourself vomit. It actually sounds reasonable, but it's strictly prohibited. It's not safe to induce vomiting to treat poisoning. When a person vomits some poison, such as acids, this increases the risk of burns and other injuries in the esophagus, throat, and mouth. In addition to poisoning, there might be other scenarios in which a person wants to induce vomiting. For instance, they may have an eating disorder or feel nauseated due to a stomach virus. Vomiting always carries risks, and there's no medical reason for a person to induce vomiting just because they feel nauseated. So the best possible way to cure in case of poisoning is to get to the hospital as soon as possible. Rescuing a drowning person. A drowning person is probably the most difficult one to try to rescue. If you know how to swim, it's not a problem to save a person's life. In a panic, a drowning person is likely to claw at rescuers and climb to the surface at all costs. You should never attempt a direct rescue of a conscious drowning person without proper training. It often happens that drowning person and their would-be rescuers are lost together. So help the person by pulling his chin, placing the head to your belly towards the shore. Pulling out objects from wounds. If the object is small and sticking out of the wound or visible in the wound, remove it with clean tweezers. Use care not to push the object further into the wound. Bleeding may increase when the object is removed. If the object is hard to remove, leave it in place for removal by your doctor. Don't try to be over smart. No matter how scary a knife in the leg looks, never pull it out. You just go to the hospital. Applying ice to the bruise. Put ice on your bruise right after you get injured. That can reduce the size of your bruise, which may allow it to heal faster. The cold temperature from an ice pack makes the blood flow in that area more slowly. It may reduce the amount of blood that leaks out of your vessels. Ice the bruise with an ice pack wrapped in a towel. Leave it in place for 10 to 20 minutes and then repeat several times a day for a day or two as needed. Compress the bruised area if it's swelling, using an elastic bandage, but don't make it too tight and elevate the injured area. Using stitches to close cuts. It's not wrong to use stitches, rather, in most cases, it's the only way to close a wound. But it often takes more time and is a painful procedure that requires removing the stitches after the wound heals. Skin glue is a special medical glue used to close wounds. It forms a protective waterproof covering over your wound. Skin glue is usually used for cuts or wounds that's small or minor, up to about 5 centimeters long, and have straight edges that can be easily pulled together. Skin glue is often used to close wounds on the face or head, some parts of the arms and legs, and the trunk of the body. If the wound is too big, then go to hospital and take the doctor's advice. Like this video if you found it useful, and tell us your first aid stories in the comment section below. Also share with your friends, relatives, near and dear ones so they don't feel confused when somebody needs any help. Join us right here for the next episode on Brain Drain.